Benefit from trusted clinical content and the latest medical research with Clinical Key AI. Now offering individual, annual, and monthly subscriptions. Start your free 14-day trial today. Streamline your treatment recommendations and tackle complex clinical questions with our advanced AI conversational search tool. Designed specifically for clinicians and residents, access a wealth of knowledge from Braunwald's heart disease to The Lancet, all at your fingertips. Visit join.elsevier.com/free trial CKAI to begin your trial today.
Hi, everybody. I'm Michael Carrese, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. We continue our year of the Zebraseries today by introducing you to a rare genetic mutation called CACNA1A, which can cause muscle weakness, migraines, paralysis, and even life-threatening seizures. Many variants can also cause neurodegeneration. Joining us to help understand the disorder and its implications are Kristi and Eric Levine of New Jersey, the parents of two children, the younger of whom, Trey, was born with CACNA1A and is currently the only known person with his particular variant. Kristi and Eric both work full-time and have become experts at juggling work, caregiving, parenting, advocating, and volunteering with the CACNA1A Foundation. So thanks very much to both of you for joining us today to share your family story and help raise awareness of this disorder.
Thank you for having us.
Thank you.
So I'd like to start with learning more about you and your lives before your journey with Trey's health issues started. Eric, you want to kick us off?
Kristi and I met at the end of 2010, both lovers of live music and of the band Fish. So we met through mutual friends at one of their concerts, started dating, got married in 2013, had our daughter Stella at the end of 2015. And then to the summer of 2022 is when Trey was born.
I'm a teacher. I teach Montessori 3 to 6-year-olds, and I have a master's in early childhood. So I spent most of my time just with kids, observing them a lot and understanding how they develop and helping families through, the process of education and supporting their kids as they grow. So, when Trey came, it was pretty apparent to me that something was going on with him just from being around children for so long and understanding how they grow.
And what are some particular things that you picked up on?
So I know like when infants, they're growing, their eyes sort of wander a little bit when they first are born. But as he grew bigger, he was about 4 months old and his eyes were still wandering and they were doing some movements that weren't necessarily normal. So we went to our pediatrician and I pointed it out to her and she agreed that we should go to an ophthalmologist and get it checked out. So it was about our second visit with her, with our ophthalmologist, that she took a look at Trey and was like, it might be a vision issue, but I think it's more than that. So we think that you should go down to CHOP, which is the Children's Hospital of Philadelphia, and they have world-renowned doctors. They will give you the best care. So we took a trip down to Philly and met with a neuro-ophthalmologist there because she felt like it was more than just his eyes. And that was when we sort of started the whole process, the diagnostic process of figuring out what was going on with him. We did an MRI. And we did an EEG. We thought he was having seizures because of the way that his eyes move. They sort of roll back. They sort of like roll back into his head and it looks like he's having a seizure. So we did an EEG to make sure, but his eyes did that several times during the EEG and it wasn't considered seizure activity. So we kind of went on from there. And it was at that point that they were like, with the eye movement issues and the fact that he was missing so many developmental milestones, they felt like it would be a good candidacy for genetic testing. So that's when we met with a geneticist and did all the blood samples and Eric and I were both tested. And that was when he got diagnosed with cerebral palsy before we did the genetic testing because of the way that CACNA1A affects his movements. It looks pretty similar to a child who would have cerebral palsy, but once we got the genetic results back, we found out our answer.
We've talked to a lot of folks on this show who have a rare disorder themselves or their child does. And as you guys, I'm sure, know, it can take years and years for physicians to pinpoint it. So at least you didn't have 5 to 7 years, like other folks, but still.
And it's tricky, though, because we've heard that from parents and doctors, glad you guys caught it so young. But for us, it was quick, but it's still, we were just that whole time just waiting for a diagnosis, thinking we had it with the cerebral palsy. So it seemed like forever for us. But...
Well, no, and I was going to say, but it really doesn't matter because you still have all that anxiety and the unknowns and thinking it could be a million other things, and not having any idea. So that's a rough road. I said in the introduction that he's the only one they know of with this particular variant, but help people understand just how rare this CACNA1A is, generally speaking.
So CACNA1A is actually the abbreviation for the gene. So it's the calcium channel, and that affects the calcium channels within the brain primarily and in the cerebellum. So it affects things like his motor skills, his balance, his coordination, his posture, and his speech. So with children with CACNA1A or adults with CACNA1A, they actually think that if more people were tested genetically, that actually it wouldn't be as rare as it is. What makes it interesting is that there's so many different variants of the gene. So Trey's particular variant, they haven't found anybody else who has that same variant. And that's pretty common for most kids and most people who are diagnosed with CACNA1A related disorders. But there are a couple of variants that they've found are replicated in people. So those are the ones that they're mainly spending their time studying and things like that. So the disorders that it causes are on the more severe side. It's things like epilepsy, something called a hemiplegic migraine, which is basically like a stroke. It's paralysis on one side of the body, and that can be a loss of skills. And then eventually they would work to gain it back. Episodic ataxia. And luckily for us, Trey hasn't really exhibited any of those more severe symptoms, which is, we're always on the lookout for
Sure.
it. And we're always sort of in the back of our minds, like, is today going to be the day that he has a seizure or whatever? We have like these action plans with our medical team just in case it happens, because they found with people with CACNA1A, it could happen at any age. It's not like it just happens in infancy. There's children who will have their first seizure when they're 3, 4. So we're always kind of on the lookout for those things. But for Trey, his main symptoms are the eye movements. So he has something called paroxysmal tonic upgaze, which is that sort of rolling back of his eyes. Hypotonia, so his muscle tone is very low. He has ataxia, so his balance is off. And he has just global developmental delays. So he's nonverbal, he's not ambulatory, so he's not walking. Cognitively, he's right where he should be at his age. He's almost 3 years old, and cognitively he understands, but he gets very frustrated that he can't communicate what he wants and needs, and that he can't move around like everyone else. So those are the main things that we're working on. He is also missing his CVI6. So it's the nerve on the left side of his brain that connects his eye to his brain. So his eye on the left side is always turned in towards his nose, which affects his vision. So he's in vision therapy. So that's the main things that we're dealing with Trey.
Yeah, that's a lot on your plate.
To go back when you asked, how rare it is, about a month or two ago, the first time I met a family who had a 9-year-old daughter with CACNA1A. That was the first time we met a family. And just to give you an idea, we're 2 of the 3 families, known families, that have someone with CACNA1A in their family in the state of New Jersey. So it's very rare.
Yeah. So what is it like being parents of a child with these challenges? Eric, maybe you can give us a day in the life sketch if you will?
Depends upon the time of day or the day of the week. Having our 9-year-old daughter helps a lot. She's a great help. She's also 9, so she has her needs as well. I think the most challenging thing Kristi just mentioned is just, he gets frustrated when he can't communicate what he wants, and he's able to sign a few words and say da or no or yeah, but it's just when he can't communicate and it's just constant screeching and screaming, like that's how he communicates. So it's definitely difficult to try to maintain positivity and energy while dealing with that. But I would say Kristi's kind of become an expert on it. I'm an aspiring expert. I'm getting there. It's definitely tough, but that's, going back to when I said meeting a family, just in the past few months, we've gotten more involved with the CACNA1A Foundation. And that's just made a world of a difference, just to know that we're not alone. There's a lot of people like this. I'm getting more involved with the foundation, trying to help them fundraise with different events later in the year. But that's been a huge help to us, just knowing there's others out there.
Oh, of course, yeah.
But yeah, and it's worth mentioning, with all the the issues that he is one of the happiest kids ever. He's always smiling when he's not screaming. He's smiling, he's laughing. He loves Blue's Clues. Like he can be the happiest kid on earth, but he just has to work so much harder for the most simple things.
Yeah, he's incredibly social. So if you can imagine taking this like extroverted social kid, but not being able to communicate with others in that way that he wants to, his favorite thing in the world is giving hugs and being with other people. Like he's happy when we're like out and about and he's at school with his friends and we're doing things, and then it's like when we're at home and just trying to like do the normal life things, like get everything done for the week and cook, and that's when he like loses it. He's like, I
Right.
can't.
Right. What are some of the management protocols, I guess, or strategies that you guys employ to help with all this?
One thing this is kind of like unspoken between us. We try to do a good, we're human. So we both know what has to be done, but there's times where, one of us gets overwhelmed, the other one comes in. We both have, you take care of this, I'll take care of that. But when it comes down to it and, in the day to day, we're both just doing everything. We both just know what needs to get done. It's not like she has her things, I have mine. We're just all in, hands on deck, just trying to make it work, especially during the week, trying to get ready for work and school. It's just,
Yeah, it's like survival mode, basically. I mean, we're both working, and then Stella's sort of in a different, she's in a different plane of life. She's like a tween now, so she's got her own things going on that we need to support, and they couldn't be more different as children. So like, she's very active, she dances, and she is very mobile, and he is not able to do those things. So, but she entertains him, and we have really set up our house to sort of foster his needs as much as possible. So, we have like a play area where he can be on the ground and sort of access his toys independently. He's got his favorite things that entertain him. He loves his Tony box. He loves stories and songs and books. And so we've sort of set it up so that he can kind of play on his own, and Stella will help him with that when we're just trying to like, cook dinner or clean up or whatever it is that we need to do. We just do the best that we can with what we have. So
what is happening on the research front, and is there like even a center beyond CHOP where you guys have been able to get some assistance on all this?
Yeah, so the CACNA1A Foundation has been incredible. They actually just opened with the University of Texas at Houston. They opened the first CACNA1A clinic in Texas recently, within the last like month or so. So that was really exciting. And I know that there's been some people in the community who have been able to make an appointment there and travel there, and have said that the team is incredible and super supportive, and everybody's been amazing. we have not yet been able to travel to Texas yet to get there, but maybe one day in the future we'll be able to take Trey down there. And so I think that's like the most important thing is like, when we got our diagnosis, as wonderful as our geneticist was, she basically printed information off of the CACNA1A website and was reading it to me. Doctors with these rare diseases, they don't know about them.
Sure.
And so, I'm trying to like soak in all of this information about my child's diagnosis. And they're basically like, here's a website that you can go to find out more information. And we're so lucky that that was there, because in a lot of cases, there's nothing. Like, there's no website, there's no community.
Right.
And a lot of parents are starting from the ground up and actually creating it. We're very lucky that it was already established a couple years before he was diagnosed.
Aside from CHOP, for us personally, that's it. Like, without CHOP, I don't know where we would be. And every doctor, whether it's in Hackensack or wherever we've gone, everyone has the best intentions, but it's the nature of it. It's not a lot is known about it. So, as much as CHOP has helped us, we know there will, eventually there'll be a lot better options. We just don't have them.
Yeah, so now I remember where my train of thought was going. So when we got our diagnosis, basically what I did is I just went on to Facebook and I found the CACNA1A community, and I was just looking for any doctor who knew about CACNA1A. And luckily they had a conference, and I looked for a doctor who spoke at the conference who was within, driving distance of New Jersey. And that's where I found Dr. Helbig. And that's where I found, CHOP. And basically that's where we constructed our medical team. And now, you don't want to, once you have a medical team established, you don't want to leave that.
Sure.
So now we're we have to stay near Philly. So.
Right.
It's also, I just want to shout out, I keep mentioning CACNA1A Foundation. It's worth mentioning that Lisa Manister and Sunitha Malapati, I hope I'm pronouncing that right, they both started the foundation during COVID, like as soon as lockdown started. And, from their couches, just, 24/7 working on it. And it's without that dedication to get this started, just like with CHOP, I don't know where we'd be without them.
I'm glad there is some community, because we have run into folks on the show where they did exactly what you described, Kristi. There was nobody else and no resources and no information, and they had to go from scratch. So it's amazing what people can do. So before we started recording, I was noting that there was a big science story recently about gene editing breakthroughs that have potential implications for rare diseases across the board. Tell me what your understanding is about that and how it might or not influence what's going on with Trey, but also just, is there any other sense that there's work being done, or is there anything on the horizon that might end up being applicable to CACNA1A?
When I got, there's actually a couple of friends and family members that sent me the link when I woke up that morning and saw that. That's the kind of moment Kristi and I hope for, is, oh my God, there's a cure type kind of thing. And it's, you read the article and it's amazing what they're able to do. And it absolutely, shows progress.
The child that had the editing done, they had a genetic mutation that affected the liver. From what we understand from, researchers and scientists from the CACNA1A Foundation, they put out a newsletter, and basically what they were saying is that the gene editing for the liver is it's a lot simpler than editing something that affects the brain. And so, as hopeful and as exciting as it is, it's a long way coming for CACNA1A patients. So we're just going to keep being hopeful and hope that research and different treatments become available over his lifetime. Right now, the treatments that are available are few and far between. It's just basically managing the symptoms. So if you have epilepsy, there's treatments for epilepsy. If you have hemiplegic migraine, there's action plans in place for the emergency teams that would be dealing with that. There's, therapies and things to help with the muscle weaknesses and the coordination and things like that. So, Trey's in all the therapies. He's in physical therapy, OT, speech, vision, DI, all of it. And, we do the best we can and manage it and schedule it in as best that we can. But as exciting as things like the CRISPR gene editing are, it just feels really far away for kids like ours. So
I hear that. Eric, you'd mentioned before that there's fundraisers and other stuff going on with the foundation. Do you want to give us a little bit more information on that, or how folks can get involved if they want to help?
Yeah, absolutely. There's some stuff that's, tightly sealed, can't talk about yet. So a few months ago, when Kristi and I have known about the foundation since Trey's diagnosis, but we didn't feel like we were involved really at all, other than just getting their emails. So I reached out to Lisa, and so many words just, how can I help? How can we help? How can we, not just Trey, but the foundation in general? And she, they do an annual 5K that just happened a couple weeks ago. But she said that the main takeaway from our conversation was they need help fundraising. And as though when Kristi just mentioned that the promising research is still far away for us, it goes to show that fundraising really, there's a direct result of fundraising. So what I'm trying to do now is organize, right now I'm working on a concert for the end of the year that I want to kind of, have that be the foundation, and then continue with events next year, just all dedicated to not just raising money, but raising awareness. Because like Kristi said earlier, it's not as rare as people think it is. It's just there's not enough testing and not enough knowledge out there.
Right.
So yeah, my mission is to just help as much as possible and try to, whether it's music fans or just people who wouldn't normally come across anything like CACNA1A, how can we spread the word to the different audiences?
Yeah, no, it's important work. And you never know, as you make these efforts and the ripples go out, how they're going to connect and what can build off of that,
Exactly.
As you may know, we have a lot of medical students, nursing students, other learners in the health professions in the audience, and also folks who are early in their careers providing health care. What would you like medical professionals to understand about your situation and how they should approach dealing with the parents of children with rare disorders?
Yeah, I think being a parent of a child who's medically complex or disabled is really hard. And I think we just want medical professionals to respect and to understand what we're dealing on a day-to-day basis and to see our kids holistically. So not just trying to fix the problem medically, but understand that for us, the biggest thing that we want for our kids is just their quality of life. We just want them to live the best life that they can and feel supported in that. And yes, we would love if there was a quick fix for it, but we know that that's not the reality. And, there's part of me, I can't speak for Eric, but there's part of me that grapples with wanting to quote unquote fix our child because it's who he is. It's part of who he is. And if we take that away, is he going to be the same person? So we just want to be respected. Sometimes I feel like we know more about it than the doctors that we're talking to sometimes.
Which is probably true.
Yeah. And, we just want to make sure that he's having the best life that we can give him and to not feel the guilt. There's a lot of guilt involved in being a parent of a child who has a disability because you never feel like you're doing enough. You never feel like you just never feel like you're doing enough. And we're doing all that we can. And we're giving so much of our time and energy to this. And it's just hard. So we just want to make sure that if we have a difference in opinion, that's being respected, and it's not that we are, that we think that we know more than a medical professional. Obviously we don't, but that our opinion is important, and our child's quality of life is the most important thing.
For me, I just really respect, encourage just being real and honest. I'd much rather professionals say, I have no idea what's going on, than try to, fake that they do know, but also, just to what Kristi said, respect that, just holistically what's going on, and not just the data and what's coming out in reports and whatnot. Yeah, just being real and understanding that we're parents.
Yeah, and listening.
Yeah.
Mm-hmm.
We hear that a lot from other folks in your shoes. Well, as we wrap up here, is there anything else you wanted to talk about, get across to our audience that I didn't ask you about?
Yeah, we just want to shout from the mountaintops that, to make everyone aware of CACNA1A. And, I know from, just living life, that when you hear, a new multiple syllable diagnosis, you have no idea what it is, it can kind of be easy to ignore or brush away. But if you just do 5-10 minutes of reading and understand what it is, and know that there can be a lot more help than there should be a lot more help than there is. We just need more people to become aware of it to make that so.
Yeah. You never think it's going to happen to you until it does. It was a huge surprise to us that I think when we were doing the genetic testing, we thought it has to be from one of us,
It's awesome. Yeah.
And it was considered a de novo mutation, which means that he's literally the first person in our family to carry it. And so you just never think it's going to happen to you until it does. And
there's no, group huddle. Like Kristi said earlier on, we knew right away something was going on, and it was, deeply concerning every day. But from when we first noticed the diagnosis till now, there was never a time, we're like, hey, your son has this, this is what it's like. It's just, day after day, finding out a new, something else he's not able to do, another milestone he's not able to reach, another diagnosis, and you just have to roll with it. You just have to go.
Right. No, it's reality times 100, as far as parenting is concerned. But it sounds like you guys are on top of all of it. And I want to thank you very much for spending time to share the story and help raise awareness. And of course, we just wish you all the luck in the world.
Thank you for having us.
To learn more, you can visit the CACNA1A Foundation at www.cacna1a.org. I'm Michael Carrese. Thanks for checking out today's show. And remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelines podcast.